Well, medical tests are often essential to maintaining good health.
But increasingly, questions are being raised about over-testing, especially when it comes to routine screenings for cancer. Dr. Zorba Paster joins us from his clinic in Oregon. Hi, Zorba. Good to see you.
Good to see you guys, too.
So what is the concern with over-testing?
Well, you know, we're in a society where we think, why not test for everything and why not keep on testing? And that particular attitude is what leads to over-testing. So this was a particular study looking at senior citizens 65 years of older who had a decreased mortality. In other words, they might have had heart failure, end-stage diabetes, end-stage kidney disease, but they had a very good chance that they were going to perish. They were going to die within the next 5 to 10 years. They looked at those people and they looked at cancer screening and they found out that, lo and behold, 35 to 50% of them had screening for cancer, which would probably never affect their mortality. So the perfect example is prostate cancer. You have somebody who may be 80 or 85 years old, who may have end-stage heart failure, and they're worried that they may have prostate cancer, when in reality, most prostate cancer hits you when you're younger. And if you screen for it, you'll find it, but you won't necessarily improve that person's chances of living longer. And all of a sudden, you found a cancer, and what are you going to do? Often that means surgery.
It's a tough decision, I would think, for both patient and doctor, though, to say, we're not going to check this.
Well, that's exactly it, but there is a point at which we stop. So, for example, the national evaluation now for Pap tests is a woman should not have a Pap test over the age of 65. The chances that there's going to be cancer there are very minimal. But I'll give you a good example. 33% of the women over 65 in this study who had a hysterectomy for benign reasons, in other words, they had their uterus out for bleeding, were still getting Pap tests. Pap tests are worthless in women who have had a hysterectomy for benign reasons. And yet lots of doctors are still doing Pap tests, but there's no cervix there. Very good example of over-testing.
And what about mammograms? The recommendations for mammograms seem to change all the time.
Absolutely. The data for mammograms show that they're very effective for women under the age of 70. And even though there's a lot of breast cancer for women over the age of 70, mammograms have never been proven to save lives. So for mammograms, the best recommendation is it's an individual decision made by a woman and her doctor on her past history, her family history, and so on. So that's a very good example. But colon cancer, for instance, is once every 10 years because it's a rare event. If you're 80 years old or 85 years old, the recommendations are not to get a colonoscopy, and yet many are still getting colonoscopies, even though the risk is very, very minimal that they'll actually get colon cancer.
So why are we doing it?
Good question. Part of it is habit, part of it is not following federal guidelines, and part of it is education from the point of view of a patient. We're used to the fact that we should continue to screen, when in reality, screening is only as good as it will reduce your chances of actually dying from the disease. If it doesn't reduce your chances of dying from the disease, there's no reason to screen. And we are now beginning to learn that there is something such as too much screening, and that's the point of the study.
Very interesting.
Very interesting, yeah.
All right,
yes.
Zorba. Thanks for being with us again.
Good to see you, Zorba.
Thanks.